Hi, welcome to another episode of Bringing Hope to Alzheimer's. I'm Ann Frazier, and today we're going to talk about some of the myths or the things that are going around that people hear about dementia and Alzheimer's that may or may not be true. So let's dig right in and let's talk about if you're a big TikTok, Facebook, there's so many ways that you can get information these days. And even just Googling doesn't always necessarily mean that you're going to get accurate information. And so if you are going to specifically TikTok or whatever, and you're watching all of the different videos that are coming through time and time and time again about this causes Alzheimer's, whether it's medications, statins, diabetes medication, whatever it is, there's all kinds of people that are just giving you a lot of advice that may or may not be correct. And so my advice to you would be, first of all, if you are wanting to get more information about Alzheimer's or dementia, then you definitely want to go to a healthcare professional. And I always love starting with an integrative medicine or functional medicine doctor. They are trained to make sure that they're not just looking at your symptoms, they're actually going and looking at root causes of what's causing your symptoms, which I absolutely love. It's a little bit of a holistic approach, but yet they do prescribe medications. There's so many great things, but I absolutely love this approach, along with a neurologist and getting kind of your team set up, so to speak. But if you're just really curious and wanting to get information, then I would go to some trusted resources. I will tell you, Dr. Bredesen, you can follow him. He has books out. He is a fantastic neurologist that is showing so much great information and has really done the studies and the research to be able to back up all of the things that he teaches and he tells people about. Dr. Daniel Amen, he is a well-known psychiatrist, but he does, and he's known for doing SPECT scans, S-P-E-C-T, SPECT scans on brains. And he has so many books about memory, about your brain, about making your brain better. He is phenomenal in his research about the brain. And I will tell you personally, from seeing the scans that I've done there and seeing just since I've seen him and the different supplements that we've added to my regimen have absolutely helped my brain in so many ways. And there's so many more. Dr. Hyman, there is so many, I can't even begin to tell you, but just if you started with those three, Dr. David Perlmutter, if you start with some of these people who are really, really on the front lines of helping people really get an understanding of what's happening with Alzheimer's, what's happening with dementia. And remember, I always say this, remember that dementia is the umbrella. And there's a lot of different kinds of dementia, Alzheimer's being the most common, the one you're going to hear about and that most people are getting. But sometimes it can be misdiagnosed. So those are things that if you're looking at someone who's having cognitive issues, then you can start out by saying, they have dementia, but until you get the testing and find out for sure what kind of dementia they have, then you don't want to just pinhole that in. You want to get your medical professional's advice and really figure out what's going on. Sometimes there's so many things that can mimic dementia or Alzheimer's, but it absolutely can be something completely different. I will give you an example. For example, if your hormones are off, and this goes for men and women, but if your hormones are off and you're experiencing cognitive decline, having hormones off enough can cause all the symptoms of Alzheimer's or many of the symptoms. So that's just one. If you have your uric acid levels are higher, it doesn't mean that you have to have kidney disease or you don't have to have gout, but if your uric acid levels are higher, that can cause a lot of the same symptoms of dementia or Alzheimer's. So that's why it's so important to make sure that you've got reliable, trustworthy medical professional in your corner that's really checking out all the things. and then really checking what the brain's doing, what's going on inside the brain. And that's not an MRI necessarily. It's going to be a PET scan or a SPECT scan or some of the other scans that are going to be a lot more detailed. So those are things that I would suggest people start with. And don't always just believe everything you hear or read unless you're getting that information from a trusted professional. So I hope that helps, and I hope you're having a great day, and we'll talk to you next time.